Sarah noticed that her 4-year-old child is behaving differently from other kids of the same age. He preferred to be alone, doesn't started talking properly, sometimes shows hand flapping, not friendly with others, shows impaired gestures, repeated use of some words, loves to play alone. So Sarah decided to consult a healthcare professional. He was diagnosed with autism spectrum disorder. Let's have a look at this in detail, like the features, the symptoms, causes, diagnosis, and management of autism spectrum disorder, and the tips for parents. Triad of features. The three core features of autism spectrum disorder are poor social interaction. They are not able to form social relationships. Restricted and repetitive behavior. Shows restricted and repetitive behavior patterns. Language and communication difficulties. Language delays and speech deficits. This summarizes the difficulties of autistic child, or these are the areas where all people with autism have difficulty with to some degree. Symptoms. Social impairment, aloofness, lack of interest in people, unresponsive to social cues, poor eye contact, no capacity to share or understand emotions, failure to develop normal attachment. Patterns of behavior: hand flapping, rocking, restricted and repetitive behavioral repertoire, insistence on routines, resistance to change, true obsessions or compulsions. Communication difficulties: distorted and delayed speech and language development, echolalia, that is repeating same words again and again, then stilted rate and rhythm of speech, impaired use of gestures or facial expressions. Causes. Many people with autism have slight changes called mutations in many of the genes. Mutation cause specific symptoms of autism. Mutation control how mild or severe those symptoms are, and mutation increases greater risk to autism. Research shows that certain environmental influences may further increase or reduce autism risk in people who are genetically predisposed to the disorder. Not everyone exposed to an environmental risk factor for autism will develop the disorder. Increased risk: advanced parent age, either of the parent. Then pregnancy and birth complications. Example, extreme prematurity, that is before 26 week, or low birth weight, multiple pregnancies, that is twins or triplet, etc. Then pregnancies spaced less than 1 year apart can increase the occurrence of autism. Scientists have conducted extensive research over the last 2 decades to determine whether there is any link between childhood vaccination and autism. The result of this research is clear, that is, vaccine do not cause autism. Diagnosis. Autism can be detected in children as young as 18 months old, and in some cases even younger. In many autistic children, the condition might go undetected until they are teenagers or adults. While there are no physical tests to help diagnose this autism spectrum disorder, several developmental tests and scales can be used to diagnose the condition. A developmental screening will typically involve a series of questionnaires about child's development. If the screening identifies signs and symptoms that hint at autism, further evaluation might be needed to make a definite diagnosis. Diagnostic interview for social and communication disorder. It is an interview style test used to inquire about a person's developmental behaviors through their day-to-day functioning. Autism Diagnostic Interview Revised. It focuses on the quality of communication, social interaction, and restricted and repetitive behavior when trying to make a diagnosis. Autism Diagnostic Observation Schedule. People with severe autism who might not communicate verbally at all will benefit from the ADOS assessment. These symptoms are typically required to have been present at an early age and significantly impair their daily functioning. Management of autism spectrum disorder. No single treatment is best and management needs to be tailored to the child's needs. The aim of treatment is to lessen associated difficulties and deficits and to improve quality of life and functional independence. Behavioral. A notable behavioral treatment for people with autism is called Applied Behavior Analysis, ABA. ABA encourages desired behavior and discourages undesired behavior to improve a variety of skills. Developmental. The most common developmental therapy for people with autism is speech and language therapy. It helps to improve the person's understanding and use of speech and language. Occupational therapy teaches skills that help the person live as independently as possible. For example, dressing, eating, bathing, and relating to people. Occupational therapy can also include sensory integration therapy to help improve responses to sensory input that may be restrictive or overwhelming. Physical therapy can help improve physical skill such as fine movements of the fingers or larger movements of the trunk and body. Educational. Educational treatment are given in classroom setting. One type of educational approach is the treatment and education of autistic and related communication, handicapped children, TEACCH. In this method, verbal instructions can be complemented with visual instructions or physical demonstrations. Social relational. This focuses on improving social skill and building emotional bonds. Some social relational approaches involve parents or peer mentors. Pharmacological. There are no medications that treat the core symptoms of autism. Meditation might help manage the high energy levels, inability to focus, or self-harming behavior such as head banging or hand biting. Medication can also help manage co-occurring psychological conditions such as anxiety or depression. It helps managing the medical conditions such as seizures, sleep problems, or stomach or other gastrointestinal problems. Psychological. Cognitive behavior therapy, CBT, is one psychological approach that focuses on learning the connections between thoughts, feelings, and behaviors. Complementary and alternative. These treatments are often used to supplement more traditional approaches. They might include special diets, herbal supplements, chiropractic care, animal therapy, arts therapy, mindfulness, or relaxation therapies. Then tips for the parents. Focus on the positive. Praise them for the behavior they are doing well. It will make them and you feel good. Stay consistent and on schedule. This can make learning new skills and behavior easier and help them apply their knowledge in different situations. Put play on the schedule. Finding activities that seem like pure fun may help your child open up and connect with you. Take your child along for everyday activities like grocery shopping. It may help them get used to the world around them. Support groups. It can be a good way to share advice and information and to meet other parents dealing with similar challenges. Take care of yourself. This means finding time in your day just for yourself. Meditation and exercise can help. In this video, features, symptom, causes, diagnosis, management and tips for parents regarding the autism spectrum disorder was discussed. Hope you like this video. For more videos and related topics, please subscribe this channel. Thank you. Keep smiling.